Good afternoon, everyone. It's 2 o'clock, time to start today's briefing. Joining us today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Marlena Jackson, Interim Commissioner of the Milwaukee Health Department, and Dr. Gunjan Kanpur, Child and Adolescent Psychiatrist with the Milwaukee County Behavioral Health Division. County Executive Crowley, you're starting us off today.
Thank you so much, Sydney, and good afternoon to everybody. I want to first start off by welcoming our guest, Dr. Kanpur. He's a child and adolescent psychologist from the Milwaukee County Behavioral Health Division. And I'm so grateful for the work that she and her colleagues are doing to support the mental health of all of our Milwaukee County residents, particularly our younger ones. And so when you compare last year, it's obvious that we have a great need. And in the most recent data, county EMS data, comparing last month to November of 2019, psychological calls are up 128%. Overdose calls are up 57%, and suicide attempts calls are up 38%. And there are also disparities in the number of emergency calls between races. So when you think about African Americans right now, they make up 39% of the total mental health related calls. And African Americans only make up a quarter, to about 27% of the people in the county. So this is overrepresentation of Black folks, and yet another example of the racial disparities that we currently see in our community. And so doctor, I just want to welcome you and say thank you for joining us to really have this conversation about how we can help support the mental health of children in their lives, because it is so important. And I want to switch gears a little bit, because we continue to take important measures to keep our employees safe and keep essential services running for our community. So today, Milwaukee County, we're launching special testing site at the Mitchell Pavilion at the Mitchell Park, which is going to be dedicated for Milwaukee in-person essential workers. So I want to be clear, this is Milwaukee County essential workers. So these groups include folks like mental health service workers, bus drivers, highway maintenance workers, snowplow operators, 911 operators, our sheriff deputies, among others. And so these folks are the backbone of Milwaukee County. We want to make sure that we continue to provide the services that folks rely on. So we want to provide that testing. And so this new site will increase access to testing supplies and help ensure faster turnaround times for test results. So county employees are eligible for testing at these sites if they have COVID-19 symptoms and they work at least part-time in person, or if you've been exposed to COVID and is critical infrastructure worker that is ongoing in order to adapt to quarantine. So let me be clear, again, this is for Milwaukee County employees who are essential workers who work in person. This is to ensure we can continue to provide those critical services that many people rely on. But all those other exposed employees, as well as the general public, we still encourage you to get tested at a community testing site. And so you can find information by either calling 211 or visiting testupmke.com for more information. And so these sites, the startup funding is coming from these services, is coming from CARES dollars. And so, which we know expire at the end of this month. And so, using these to cover the 2021 dollars, we're using tax levy, which is another reason why resources are critically important right now. And so as we talk about funding, I had a chance to speak on a panel with the Wisconsin Policy Forum to discuss the state of local government budgets with colleagues from all across Wisconsin. And they included Waukesha County Board Chair Paul Decker, the mayor from Wausau, Katie Rosenberg, and Green Bay Mayor Eric Gingrich. And while some jurisdictions are doing better than others, it's safe to say that we're all facing some tough choices when it comes down to budgets. And so what is clear is that we have to stay ahead of this virus and provide capacity for testing, prepare to distribute this vaccine as it comes online, and keep essential services up and running and keep our businesses, especially our small businesses, open. And so all panel participants, we all agree that our ability to provide the current level of services and support greatly depend on federal support. And it looks like though our federal delegation is moving closer to a deal in Washington, we want to continue to ask for more direct support through direct and flexible funding to state and local partners. And so just as the county budget and city budgets, they're taking a hit the state is. And we see that. In fact, Wisconsin is facing one of the toughest budgets that it has faced over a decade. And so, when the Wisconsin Policy Forum yesterday released the report, it brought out the challenges that we're going to be seeing. And we understand those challenges here in Milwaukee County. We know an influx of federal or even state funding due to this pandemic is important, but it's not sustainable. And we have a solution for this, and one that will be no burden to the state. So we continue to talk about and support a 1% sales tax increase, which would allow us to raise revenues that we need to support local services. And I know Mayor Barrett, he has been a champion of this effort, along with our Move Forward Milwaukee partners with the MMAC, the Greater Milwaukee Committee, the ICC, and many other community partners. So to be clear, we're not just asking the state for more money. We're asking for the authority to go to voters through a binding referendum if Milwaukee County should increase our tax by 1%, but also to provide some property tax relief. So the bottom line is, if Milwaukee County does better, the whole state does better. And the state can provide us these tools that will not only help Milwaukee, but all municipalities across the state to continue growing and generating the funds we need for critical services like mental health and COVID relief. And so with that, I'd like to turn it over to Mayor Beard and say thank you for the partnership and what you're doing.
Well, thank you very much, Mr. County Executive. And I want to concur with the statements that the County Executive said. We have repeatedly gone to the state legislature and asked for this ability to let our voters decide, or let us decide here locally, what we can do or what we need to do in terms of our revenue needs, because so many of the restrictions placed on us are being placed on us by the state legislature. And we're simply saying, take the handcuffs off, because we need to have more flexibility to deal with these issues. Earlier today, we had a meeting with our health commissioner, with Dr. Weston, with Dr. Tamaro. And one of the things that we talked about, and Commissioner Jackson will talk a little bit later about some of these issues as well, but I just want to touch on them initially. What we have seen over the last week or so is we've seen a decrease in the number of people getting tested. Following Thanksgiving, the numbers have been going down at a pretty steady pace. Although today they're up a little bit. We had 1,457 people who tested yesterday at Miller Park. We had 261 on the Southside Health Clinic, and we had 442 on the Northside Health Clinic. But the numbers, generally speaking, have been going down since right before Thanksgiving. And we were talking about what the cause of this is. And I think there are several factors here. I think that there were more and more people getting tested prior to Thanksgiving in preparation for that. And I think that following Thanksgiving, I think that there is the fatigue that we have all talked about. There's the cold weather where people don't want to go out more when it's cold. And this would not be as troubling if not for the fact that we still see a high percentage of positive readings. In other words, the testing numbers are going down, but we're not seeing a corresponding decrease in the percentage of people testing positive. That means, unfortunately, that this disease, this pandemic, is still in full throttle. And I assume that if more people were tested, the numbers would go up. And I'm sure Dr. Weston will talk about some of these issues. But the message I have here today is, we all know that with more and more of the attention in the news being paid towards the vaccination, that there might be a natural tendency to let our guard down, to say, oh, we got this covered because the vaccine's coming. We also, though, should know, and people should know, that even in the best case scenario, getting this vaccine out to as many people who need it is essentially a half-year project in a best case scenario. If we start vaccinating next week, the FDA will be meeting later this week on Thursday and Friday. And of course, it's our hope that, assuming that the dosages are safe, that'll be approved and we can start next week dealing with healthcare workers, dealing with the elderly. But that's a small percentage. The reports today were between 50 and 60,000 dosages that we would get in the first run. But as I talked about last week, bear in mind that when you talk about the number of people who work in healthcare, the number of people who are residing in our long-term care facilities, and the number of people who are in our nursing homes, we are basically at less than 600,000. And so getting 50 to 60,000 dosages just to cover that 600,000 number shows you how far we have to go. But much is being shared in the news regarding the COVID-19 vaccine. And I want everyone to know that our health department, and Commissioner Jackson in particular, have been in close conversations with the state regarding the vaccine distribution plans. And Commissioner Jackson will share more details on this later in the briefing. I want to talk a little bit about the holidays. It's clear the holiday season is now upon us. The days are getting shorter till December 21st, when they start getting longer. Colorful lights are popping up across the city, and people are beginning to shop for their loved ones. I think we all recognize COVID-19 presents some very unique challenges to our usual holiday gift giving. Many of us are now shopping online, and that brings obviously lots of trucks traveling throughout the city and making deliveries. But remember, COVID-19 has hit our local small businesses, restaurants, and theaters incredibly hard this year. And many would appreciate your support this holiday season. So when you're going online, when you're going to Amazon, think twice about maybe you could consider shopping locally and ordering gift cards or presents for delivery or curbside serve pickup from our local vendors. You can even show your appreciation for frontline workers and essential workers who have stepped up this year, like the teachers who are balancing online and in-person classrooms with a gift from a local store. Not to mention, consider donating to nonprofits and local charities, helping individuals who find themselves on hard times due to the effects of COVID-19. You can consider supporting the city and county's holiday drive, benefiting local shelters like the Guest House of Milwaukee and Hope House of Milwaukee at milwaukee.gov/holiday drive. Our annual holiday drive is in full throttle right now. And again, we're this year devoting everything we raise to the Guest House and to the Hope House because we see great need in both those locations. In this time of giving, let's look out for one another and support each other to the best of our abilities. So please consider spending your dollars locally this holiday season. Finally, I just want to touch on the importance of testing once again. Our efforts to address the pandemic have relied on science and real-time data. We closely monitor our testing numbers, and as we have all noticed, our testing has been steadily decreasing. I want to turn it over to Dr. Weston, who I think obviously has really chewed on these numbers and chewed on all the challenges we face. But I want him to be able to talk to all of us about why testing is important and why it's important to get these testing numbers back to what they need to be. So with that, I'm going to turn over to Dr. Weston. Doctor?
Thank you, Mr. Mayor. Good afternoon, everyone. First to our numbers, we've had 73,487 confirmed cases of COVID-19 in our community and 739 individuals who have died in Milwaukee County. So as the mayor mentioned, we're seeing a specific combination of trends in the county that strongly suggests that frankly, not enough individuals are seeking out testing. So on one hand, we have a decline in our daily new COVID cases. However, that decline mirrors a similar downtrend in individuals seeking out testing. So where 2 weeks ago, we were averaging nearly 7,000 tests per day, we're now just over 4,400 tests per day, a major decline. And in fact, the Miller Park testing site performed less tests yesterday than any Monday since the site opened up back in October. So testing allows us to recognize the burden of COVID-19, but it also allows individuals to know their status and decrease the possibility of transmitting to others. So with our decrease in testing, it makes sense that we would have a resultant decrease in cases. And so the statistic that really shows this to be the case is our percent positivity. So this is the percent of people who are testing positive for COVID, and this is rising in our community. This is the most reliable number, the most reliable indicator that we have, and it shows that the disease burden in our community is worsening. We're over 14% positivity and rising. And this is likely the beginning of the effects of Thanksgiving gatherings that we're starting to see, and likely the tip of a larger iceberg to come. This is to say that we need more folks to seek out getting a test. There is excitement, and there should be excitement around the vaccine soon becoming available. But as the mayor mentioned, it will not be widely available and will not greatly affect our disease burden, likely for several months at least. In the meantime, we need to focus on the fundamentals: safety measures and testing. Safety measures, that's distancing, that's mask usage, and testing, particularly for those with symptoms, those with close contact with someone who tested positive, or those referred by a healthcare provider or public health practitioner. And a quick note on symptoms: we always state that those with symptoms should be tested. But remember, these symptoms can vary widely. They can be cold symptoms like congestion, runny nose, a sore throat. They can be respiratory symptoms like shortness of breath or a cough, stomach symptoms like vomiting or diarrhea, or flu-like symptoms like fevers, body aches, headaches. Any of those symptoms can be COVID. So even those with what seems like a minor cold need to get tested. You can be just as infectious with minor cold symptoms and COVID as you can with fevers and shortness of breath. And remember that your minor cold symptoms can easily transmit and lead to someone else being face down in an ICU struggling for breath. So please continue to get tested. It's one of the simplest ways to contribute to the ongoing safety of our community and help us get through this pandemic. You can visit testupmke.com for details on all the ways to get tested easily and get your results quickly. Thank you very much. Stay safe, and I will hand it to Commissioner Jackson.
Thank you, Dr. Weston. So first, I do too want to reiterate some information and some thoughts about the holiday season. So as we enter our seasons of celebration around Hanukkah this week and Christmas and Kwanzaa coming up in the next few weeks, and then New Year's Eve, it's important to remember that the safest place for us to celebrate is with the people we live with at home. We want you to begin to think right now about how you can modify and change plans to help reduce the spread. We often refer to this time of year as a season of giving. And by switching things up this year a bit at home, you are giving the gift to a much larger cause of keeping your friends, your families, and the community safe from COVID-19. We also understand the mental health toll that this pandemic has taken, has caused, and more so even during the holiday season. So if you choose to gather with people outside of your own house, please know that smaller is better. If you're experiencing any COVID symptoms, do not go and consider getting tested. And just like with Thanksgiving, we want you to consider the following: location. Is the gathering going to be indoors or outdoors? And if it's indoors, what does the ventilation look like? Understanding that poor ventilation indoors with crowded individuals is not a safe place to be. Also look at the duration, the time that you're spending. If you would typically during the holidays, we spend lots of hours with families and friends. Maybe this is a time where we just drop by to stop and give food or drop off presents and then keep going. And lastly, the number of people. Again, how many people are going to be at a particular space? And to know, again, that the smaller is better. And always wear your mask, wash your hands, and when possible, keep your 6 feet distance. I do want to talk about vaccinations as well. And so as a local health department, we continue to work with the state and work with our federal communications. And we're expected to hear this week whether the emergency use for the vaccinations for Pfizer and Moderna are approved. And we continue to work on internal processes as well, while we're working to look at procurement of the actual vaccination and things that come along with needing that storage, as well as distribution planning. Please know the distribution will take place in a phased approach and as vaccines become more readily available. And while we've had extensive coverage regarding the vaccine over the past few weeks, I want to give us a reality check in that we are still months away from larger general scale vaccinations. And so we continue to see our positivity rates grow in the city and the county. We are continuing to see death numbers increase while our testing is down. And this is a concerning combination. knowing that we haven't quite yet seen the full impact of Thanksgiving. So please, if you are symptomatic, if you've been around individuals who have been positive or are symptomatic, we encourage you to get tested. Thanks so much.
Thank you, Commissioner Jackson. Up next, we have Dr. Kanpur from the Milwaukee County Behavioral Health Division, who will be speaking about effects of COVID-19 and mental health in children.
Thank you very much, and good afternoon, everyone. I appreciate the opportunity to be invited to talk about children's mental health as we head into the holidays. Firstly, I wanted to say that we all know this has been a very stressful, different, and weird year for all of us, especially so as we head into the holidays. We are likely going to be having very mixed feelings about the holidays. Many of us will be feeling sad because we have lost our loved ones, or our friends have lost our loved ones. Others might be feeling anxious because the holiday plans are going to look different. Other people will be isolated because they probably are quarantining. And many others might be feeling guilty because of wanting to celebrate the holidays because so many Americans have lost their lives. So similarly, for children as well, know the common reactions as we head into the holidays and in general for the pandemic. Expect behavioral changes, increased irritability, defiance, limit testing behaviors, or meltdowns is not going to be uncommon. Attention, concentration problems can occur as well that can impact learning. Sleeping and appetite changes may happen as well. General worry, anxiety, depression, as we talked about, is also not going to be uncommon. So what can we do about it? Approach these behaviors with compassion and acceptance and respond gently. Hold stable and focus on emotional connection. Encourage children to talk about their feelings, validating their emotions, and let them know it's okay to feel that way. Another important point to remember would also be continue to establish a sense of safety and promotion of calming. Have a safety plan for yourself, your family, and that includes basic things: washing hands, wearing a mask, keeping the physical distance, staying home if you are sick. Even though the situation outside is still continuing, the research shows that even if the threat is there, maintaining a relative sense of safety with the safety plan will keep that protective shield intact, which improves resilience. Educate yourself, read up. CDC has a lot of wonderful fact sheets. Local public health authorities, WHO, have a lot of useful information. So print it out and share it with your children. They might like it. And like adults, children also cope a lot better when they have facts. Promote calming. Think about what are the things that bring you calm and brings you joy. Remember that. Stick to a routine. Write up a schedule for yourself. Kids are reassured if they have structure and predictability. So that's going to be one of the key factors. Practice a healthy lifestyle, like good rest, sleep, healthy eating, regular exercise, and please do make a point to try to get fresh air in a safe manner, at least 30 minutes a day. Dress for the social life you want, not for the social life you have, which is the pandemic. Put on bright colors. It's amazing how dress can impact your mood. Take time to play with your children, even if it is 10 minutes a day. And find a practical and relaxing activity to do each day. As I was saying before, it could be listening to music, coloring, having a soft blanket by you, drinking hot chocolate. If that relaxes you, by all means, please do include that in your schedule. Or you can find a long-term project to dive into to keep yourself busy and distracted. That's going to be important. Social connectedness is also going to be the key to help combat the feelings of isolation. Connect with people in a safe manner. There's tremendous body of research to support the impact of social connectedness and the sustained attachments to loved ones in combating stress. So do not underestimate the power of social connectedness. As long as you do it safely in clever and smart, creative ways, that should be good. And how can you do it? What are the ways? So some things could be virtually connect with your family and friends, as everybody else was talking about before. Sharing pictures, emails, videos, hold virtual holiday meals. You can do actually the driveway holiday greetings, stop by at your family's, friends' driveways, exchange gifts, homemade gifts it could be, or share recipes, food. Connect with your community, help others, donate online to charities, even if it is $1. Collectively, it will make a lot of difference to people who have been struggling. Virtually connect with and reach out to your religious affiliations and activities and seek support from them. And lastly, but very important, hope is another key factor during the stressful times. As you talk to your children, provide reassurances and a sense of hope that actions you and your family and your community are taking will help flatten the curve, resulting in the ending of the outbreak much faster. So counterbalance the heavy information with hopeful information. Take a few minutes every day to remind yourself of that. Notice the good in others. There are tons of stories of people sacrificing and donating. Medical communities are working around the clock to help take care and find a vaccine, and we've already come a long way. Encourage your children to make future plans, make them write down things they want to do, places they want to go. And again, take a few minutes to remind yourself every day that although this is a scary and difficult time right now, this is a season of life and it shall pass, and we shall return to our free and busy lives again. And we will be cherishing our freedoms like we never have before. Also, I want to take a few seconds regarding how you can seek help and what are the warning signs. And should any of these reactions that I talked about previously, they continue for several days in a row, or you feel that you have a hard time coping, your children have been having a hard time coping, or it's coming to a point where the functioning or day-to-day responsibilities is getting challenging, seek professional help. There are mental health professionals on the ready to help you through this crisis. So I hope this was helpful, and thank you very much. Wishing you all a very happy holiday season.
Thanks so much, Dr. Kanpur. Our first question comes from Mark Stevens at CBS 58 for Dr. Weston and Commissioner Jackson. Is it true that we have not felt the full brunt of the Thanksgiving surge yet? If so, why not? Could we see that during Christmas time, resulting in a bad start to the new year?
Yeah, so when we look at the raw number of cases, I think we're seeing somewhat of a masking of the effects of Thanksgiving coming from the low rates of testing. If we don't test enough people, we will not find the cases that are out there. And this is shown in that increase that we're seeing in the percent positivity. So thinking about a typical timeline for COVID, we're not yet 2 weeks out from Thanksgiving. So it would make sense that we haven't yet seen the brunt of the gatherings that took place. I certainly hope it's not the case, but I am deeply concerned that we have worse days, weeks, and months to come.
Our next question comes from Patrick Palantonio at WISN 12 for Commissioner Jackson. When vaccinations become available, will people be able to choose which vaccine company and pick which vaccine they receive?
So like other vaccines, generally that's not something that's made aware to the end user. As we in the health department and other providers order vaccines, a lot of what we get has to do with general volume. So it might be the case that we have more Moderna or more Pfizer at a particular point or moment in time. And so the point at which it reaches the individual who's receiving the vaccine, that's not something that typically they're aware of.
Our next question, also for Commissioner Jackson, comes from Cassidy Williams at Fox 6. Does Milwaukee County know how many Wisconsin vaccine doses it will get from the first shipment, and has a distribution plan been finalized?
So again, we do continue to work with the state And at this point, we don't, as a city, know the exact numbers of vaccines that we are going to get.
Our next question comes from Sari Lusk at the Milwaukee Business Journal. What is driving the recent drop statewide in the number of COVID-19 hospital admissions? Why did the Milwaukee Health Department tighten the capacity limit on businesses with approved COVID-19 safety plans? And what do you expect will be the impact of this step? And in the first weekend with higher fines in place, what did inspectors see as relates to compliance?
So I'll start with the hospital admissions. We did see a drop statewide, and we're seeing a steady rate in Milwaukee County. It's hard to say why. We did see a little bit of a drop in case numbers, and that did seem to coincide with the hospitalization. Certainly, people tend to avoid healthcare systems around holidays. They don't want to be hospitalized, so that is a likely contributor. But the next few weeks will tell if we're going to bounce back from that number. Hopefully we won't. Hopefully we'll continue to see downtrends, or if nothing else, at least a steady number rather than an uptick.
And as it relates to the order, particularly, again, we're basing our orders and how we define particular sectors based off of science and behaviors. So behaviors that we know are high risk or low risk. So obviously the goal of all of the order is to decrease COVID-19 spread as the best we can. And as it relates to citations, we did not have any citations that I'm aware of this weekend.
Our next question comes from Ricardo Torres at the Milwaukee Journal-Sentinel. For everyone, what can city and county residents expect once the vaccine is ready to be distributed? Long lines or waits, for example?
So
I can start.
Oh, go ahead.
Thank you, Dr. Weston. So I think one thing that we have learned at the Milwaukee Health Department through our flu vaccination, as well as our testing sites, is that we have good information about what sites physically work well for mass vaccinations, similar to mass flu vaccinations, similar to testing. So I think we are ahead of the game when it comes to knowing what sites are available, and also knowing what our capacity is, how many staff do we need to vaccinate a particular number of people. So that planning is on its way. And I think as we move forward, absolutely, there will be bumps in the system or bumps in the process, but we'll figure those out as they go, just like we have as it relates to testing.
Our next question is from Mary Spacuzza at the Milwaukee Journal-Sentinel. Again, questions about Milwaukee's vaccination plans. Do you have any advice for those making big plans once they get a vaccine? For example, how long should people expect to continue masking and social distancing?
So for the vaccination plans generally, much like we did with testing, there's a cross-sector group getting together. So at the state level, at the local level, involving healthcare, involving business, involving governmental bodies to figure out how best to do this once the vaccine allocation begins. So a lot more information is going to come, and there still is decision-making happening at a national level, at a state level, as far as the prioritization, as far as the number of doses, as far as the distribution of those doses. So certainly a lot more information to come in the future. I think as far as planning, boy, it's hard to make plans. We all hope that by sometime in the spring, there'll be a large amount of vaccines so that anybody who wants to get vaccinated, which is hopefully just about everybody, will be able to get vaccinated. But it's hard to know. We've never gone through anything like this quite like this before. So I would say hold off on making any big plans. And we also don't know what the vaccine means as far as masking, what the vaccine means as far as distancing until a large number of people are vaccinated and we really have that herd immunity. But I think what we circle back to with all these unknowns is that unknown timeline. And the mayor talked about this. It's going to be months until the vaccine starts to really drive down our numbers. We can all look forward to that and be excited that there's an endpoint in sight, but it's months. And in those months to come, we need to continue to be vigilant, continue to distance, and continue to get tested if it's indicated.
And I want to put an exclamation point on that once again, because it is going to be months. And I think understandably, we all want to be filled with hope and optimism that with the vaccine here, that we're basically out of the woods. But it's going to be these last few months that probably will be the hardest ones, because we all want to get life back to normal. And I think the worst thing we can do right now is let our guard down. And I'm just looking at, the way I look at this is December 21st is the shortest day of the year. Starting December 21st, the days will get longer, which always puts me in a better mood as the days get longer, through June 21st. So mentally, I'm thinking, okay, let's get through that period where the days get longer and we'll get life back to normal. So that's my tribute to hope today is focus on June 21st, but don't get ahead of yourself and don't say, okay, it's coming, we can let down our guard.
Our next question comes from Patrick Palantonio at WISN 12 for County Executive Crowley. When will the special testing site at the Mitchell Park Pavilion open? How long will it stay open? And what is the testing capacity? And how do county workers arrange for a test there?
Well, it's going to be as open as long as we can get this virus under control, to be quite frank with you. Again, we want to be a leader in making sure that we're providing those tests for our essential workers here at Milwaukee County, because we're providing those critical services. And so folks can always contact their immediate supervisor or go through our human resource department. Again, they're going to be open for a while. We have to make sure that we are giving Milwaukee County employees, especially those essential workers that are working in person, the ability to get tested and get quick turnaround on it. With everything that is happening right now, again, when you think about the budgets of local municipalities, we got to stay ahead of the virus and do everything that we can to be our best when folks are at their worst at this moment.
Next question comes from Mark Stevens at CBS 58 for Mayor Barrett and County Executive Crowley. How will local budget finances impact vaccine distribution when that time comes?
Well, I think we both hope, we both expect that we are not going to be called on to use our local tax dollars for this, that the federal government will be handling a lot of this, or the state government. But I know from the city standpoint, I'm sure the county executive can speak for the county, this is not a burden that we can afford to carry. Obviously, we want to see it done. Obviously, we're going to work as closely as we can. But this is much, much larger than that burden that can be placed on local property taxpayers.
I absolutely agree with the mayor. We need the federal government really to step in where all local municipalities and states across this country need them to step in at. And so, nobody here locally can take this burden on by ourselves. And so we're going to have to continue to create partnerships to get things done. But we still have time to really be able to answer that question again. But again, we need the federal government and the state government to help step in when it comes to that.
Our next question comes from Sari Lusk at the Milwaukee Business Journal, a follow-up on the COVID-19 safety plans. The city's previous position was that the businesses following these safety protocols were providing a safer environment than those complying with only a blanket capacity limit. What has changed that led to this new rule?
Thanks, Sari. So when we looked at the opportunity to update the order based off of our case numbers, that is what has changed. When we looked at our percent positive across the city, we were compelled. I was compelled as a health commissioner to do what I could to make our city safer. And one of those things was looking at decreasing those capacity limits. Again, they were at 100% for restaurants that had approved safety plans. And I would reiterate that we have had up until this point over 800 plans approved. And we're very comfortable that those restaurants are taking this disease seriously and are taking their mitigation steps seriously. So we thank them for doing that. At the same time, we also began to understand more about the disease as it spread in smaller environments. So not the necessarily 200 or 300 spaces, but even smaller spaces. So between those two things, it was really the impetus to look at, as people gather in restaurants, looking at those general capacity limits.
Thank you. Our next question comes from Wisconsin multimedia journalist are there any mental health services being put into place to help people with hearing and visual impairments who need mental help that are unable to do virtual visits? Dr. Kanpur, I'm not sure if you're able to assist with answering this one.
Yes, I can. Yeah, I wanted to say the short answer is yes. There are a whole lot of resources, including for people who've been struggling with having mental health difficulties, for hearing and visual impairments as well. You can call the number 211 and get more direct help and resources. Also, people probably know by now our crisis line as well, and that would be a good source to get started, which is 414-257-7222. Also, there are other nationally recognized and trusted resources as well, which is the SAMHSA website and the resources. They have a helpline as well, which is Substance Abuse and Mental Health Services Administration. They have a disaster distress helpline, and you can call them or text them. The number for calling is 1-800-985-5990. Or you can text them as well at Talk With Us 66746. I hope that's helpful.
Thank you. That appears to be the last question in chat at this point. Are there any other questions from the media for our panelists? Okay, that concludes our briefing for today. Thank you for your time, and we'll see you back here on Thursday.
Thanks,
Thank you very
everyone.
much.
Thank you.